Hey guys, welcome back to the podcast. I am Amanda.
I'm Laura.
Right. We recently did some market research at a conference that we were attending, and it turns out that a common theme that kept coming up of pain points that you guys have is patient expectations, and specifically when we're not able to meet patient expectations for reasons that are beyond our control. So we thought it'd be good to talk about expectations today. Kendra, take us away.
Yeah. So expectations, it's touchy. It's something that we experience actually in every relationship, really. The expectations we have with our significant others, our kids, and definitely spills over in work, especially feeling it a little stronger these days. I think, we want to blame it on society and the entitlement and all the things. However, expectations sometimes, well, I would say most of the time, are unexpressed and they're just kind of stories that have been made up, maybe a movie that plays through your mind, and except for you forget to tell the actors their lines and where it's going to shoot and how long and all the things. So, this is what happens when we generate expectations, and our patients do too. So just know they're humans just like us. And when we go out in the world and expect something at a nice restaurant or expect, a gift on our birthdays from our husband and our kids whom we do everything for, right? Or we go to the salon and we expect that person to be competent and do exactly what, we're explaining or whatever it might be. It's true that sometimes these expectations are everyday contributors like movies, TV, social media, experiences of family and friends. So when you talk to people and they're generating, a story, a movie, and so you know exactly how it's supposed to play out, exactly who the characters are, exactly what the experience is supposed to bring, exactly how it's all supposed to wrap, right? However, you kind of forget that there's actors and actresses and a stage and a location and everything, and you forget to tell all those people, right, what you're expecting. And so it can become a real dissatisfier. And unfortunately, being dissatisfied is actually a breeding ground. And if you do not check those, you can really spiral down in disappointment. And Brene Brown, we love Brene Brown. We love Atlas of the Heart. Once again, making a reference to her book, she says disappointment through all of her research on shame is one of the most frequently experienced emotions. And unfortunately, it comes with a high level intensity. Because of that, disappointment manifests usually as shame. Like it's associated a lot of the time with feelings of shame. However, some people don't have that language. All they know how to say is, well, I'm hurt or I'm angry or upset. Like maybe they don't even have the language to say I'm hurt because they don't even understand that it's actually an unmet or unexpressed expectation. And so all they do is like, my feelings got hurt or that made me angry or upset. Like they don't even know what they're feeling, but it's not good and they want to move on. So when we take this disappointment, like if we describe these expectations and knowing that our patients also come to the ED or wherever, to the hospital, wherever you're taking care of them with expectations of how this is supposed to go, and it doesn't go on script, they also experience anger, hurt, whatever, and may not have language for it, but then it feels like they're projecting it on us. We didn't meet their expectations from the go, and so they project that disappointment. And so we can really take it personally. And it may just come from where they are, the chair they're sitting in, metaphorically. It has most likely nothing to do with us. And so we'll kind of talk about some ways to interact and just anticipate the fact that there's going to be some unmet and unexpressed expectation, but just know that most of the time, you all know you're competent, great clinicians offering exactly what you're supposed to offer. There are just the movies and the TVs and the social media playing through patients' heads that make this scene that is the way it's supposed to go. And we all know that that is actually not the way that it actually rolls in the emergency department or clinic or hospital or wherever you work.
Yeah, vice versa. I'm sure we set people up to fail all the time from the emergency department, like go back to your primary care and this is going to happen. And then, nope, that's not how it works in all fields of medicine for sure.
Yeah. Yeah. So it's not unusual for when we come into the interaction with the patient
for the first time, or maybe it's if you're a clinic-based physician, maybe you've been dealing with this person before. But if they've had to wait longer than they expected or have already had some sort of disappointment that day, they can approach you initially with not the nicest demeanor. And it is helpful for us to be able to respond how we want to respond, regardless of whatever they're doing. So early in my career, I know I would get totally riled up in these situations. Like, how dare they? Like, how dare they be mad at me because it had
Mhm.
nothing to do with me, right? I just got here. I just met you. Like, why are you treating me like that? What I have found is that if I can identify the emotion they're having and then validate it, it helps de-escalate things a little bit. So a lot of times I will enter the room and just say, "Hey, I am so sorry you guys have to be here today. I know that this things did not go as planned for you today. This is not where you want to be, and I'm here to help. I'm here to help." And that takes things down quite a bit. Or if they've been waiting a long time. "Hey, I know you've been waiting a really long time. That's super frustrating. I'm just so sorry that you've had that experience. Let's see what we can do to help get you feeling better." Those things I have found are really, really helpful to create a connection with those patients so that we're on the same team instead of adversarial just from the get-go. And occasionally you'll come across someone who is just really determined to be kind of nasty. And that is a situation where we really can, if we can identify what our boundaries are and what we will and will not tolerate. For example, I had during COVID, I had this patient. It was the weirdest situation. Like, he was a high risk person and was having respiratory symptoms, and there was a lot of COVID going around. And I suggested we take a COVID test because it was during the time when we were using the antibody infusions, and he would have qualified for that, and it could have helped him, if he had wanted a COVID test. Well, his girlfriend went psycho on me and did not want him to have a COVID test, but for whatever her reasons were. And she was yelling at me. I said, "Okay, I'm going to step out until we're both calm again." So for me, my personal boundary was I'm not going to stay in the room unless that patient is actively like unstable. I'm not staying in the room when someone is being unkind to me. I will step out because that's just, I can't think straight. I go into fight or flight. I can't use my good part of my brain. So I'm just going to step out, get my cool again. And then I went back in. The woman was like, literally, she was lying on the floor at the back of the room. This room had a bathroom attached to it. She was lying on the floor on her belly in that bathroom, holding her phone, trying to record me. I was like, "Are you recording me?" It was the strangest thing. And so I was like, no. And I left and I had security take her out. But rarely does it get to that. Usually, if we just acknowledge people's emotions, acknowledge their fears, and if she had been, able to do that in a way that where we could communicate, I'd be like, yeah, we don't have to do this COVID test. That's fine. We don't have to do that. That's fine. Let's not get crazy." But sometimes you do have to know what your boundaries are and what is okay, what's not okay. And it's not okay for people to treat us disrespectfully or unkindly. And at the same time, it's not okay for us to treat them disrespectfully or unkindly. And just being a little bit vulnerable, that is uncomfortable sometimes, but being vulnerable and saying, "Hey, we don't always find out exactly what's wrong with you here. We don't always get to the bottom of it. We do our best and we'll make sure that you're safe and you're going to be okay, and we'll get the resources you need. But we can't always identify all the problems, and we can't always address, the 30 complaints that you might have. We can address the one that is really the most dangerous. We'll do that. But just being open about how, we're not perfect, but we will do the very best we can does a lot to help mitigate their expectations and help them to feel like, yeah, well, they can't figure everything out, but I can see that they're trying. Another thing that's helpful is to kind of give it time frames. Certainly in the emergency department, you might be there for 10 minutes. If you're there for just a follow-up rabies shot, you might be there for 10 hours, depending on what the problem is. But letting people know ahead of time, like, hey, this is generally how long it takes to get an x-ray back and how long it takes to get labs back, and keeping them updated on that really does help them manage their own feelings of frustration and expectations about how long they're going to be there. If we communicate clearly what the process is of whatever it is we're doing and ask them what they need, what their expectations are, and what they're most worried about, and how we can best help them, and then answer honestly about what is really realistic for us to be able to do. Yeah, I can totally understand why you want a full body MRI today.
Yeah. Who doesn't? Yeah.
Unfortunately, we're just not able to do that. This is what we can do to figure out what is wrong. And just being respectful, validating their emotions, being open, and do the best we can to communicate with them when updates need to happen and be specific about what's happening next. It just helps so much for them and for us, so that we're not having to deal with a disgruntled patient that, once that horse is out of the barn, it's hard to get it back in.
Yeah, I will say one of the kind of momentum shifts for me is asking the patient, what are you worried about? Because our brains, we're ED docs that have been trained in a manner of ruling out life and limb threatening. Everything else, we're like, whatever, right? So, but that is not, the patient doesn't always come to the ED, right? Shocking for a life or limb threatening issue. And so one of the game changers for me is I've started to ask, what are you worried about, right? Because I'll get answers like, well, of course, we are up against Dr. Google all the time, or social media or whatever. Well, I saw this on social media, and then just taking a minute to be like, oh, like that has nothing to do with what you're here for, nothing to do with, we're ruling out life and limb threatening, and they're like, I just want to make sure I saw cancer, or I saw whatever rash, with the top three things, and usually my brain would go, are you kidding me? That is so out of the park. I'm like, oh, I see. And it becomes a lot easier to answer and reassure when I ask, what are you worried about? And then it becomes that reassurance. Then they're like, okay, well, I can go now. I can cancel my 14 labs and CT of the whole body.
Yeah. Okay, so Brene gives us some examples of unchecked and unexpressed expectations, and we can totally apply these to work as well. I have one personally. Was the kids both had events and were taken care of. And so my husband and I were like, oh, should we go to dinner tonight or just grill and hang out on the back patio? And I was like, yeah, no, that both sound great. And then he said, okay, I'm going to cook salmon. And I was like, oh, God. Which turns out I, in my mind, had gotten myself worked up that we were going out to dinner, but I didn't even know myself that I had created that expectation in myself until he said, okay, I'm going to make salmon then, which is a lovely thing, right? Like, how ungrateful when I didn't even know myself. So I was able to, back in the day, that could have really caused some issues, but I'm like, oh my gosh, until you just said that, I didn't even know that apparently somewhere deep down, I really wanted to go to dinner, but actually, salmon on the back patio makes perfect sense. But that was one thing, like, sometimes we don't even know what our expectations are until they aren't met, being honest with that. And then compound that with a lot of times, if you're going to a medical facility, you do feel out of control. You have lost some autonomy. It is a stressful day for you. So just imagine having to eat salmon instead of going to a restaurant times 1,000, like, of course. And I think a lot of it too becomes problematic when we start taking this stuff personally. It wasn't personal that my husband wanted to make salmon, for instance. Like, it just turns out I had this whole story in my head that I wasn't even aware of. Another one that just happened was a friend texted like, "Hey, I know you're not working with a medical question." Her son was probably dehydrated and got like a virus too, had just normal kind of stuff for us. Well, she's waking out because her mom had metastatic cancer to the brain, and that's where her mind is going. So anyone who saw her that day wouldn't know that she is amped up to 1,000 thinking that her kid also is going to have some sort of catastrophic illness. But in that way, I was able to help her like, hey, it is not a bad thing to just tell them, hey, I am just already stressed about this thing with my mom. Do you think that there's anything more serious going on? And they can just answer after they evaluate the patient. We're not very honest. We're not very forthright in our expectations sometimes. And then we're also sometimes not very good about asking our patients' expectations too. But man, that communication would make a huge difference sometimes. So here's one example. We are in the ER and we have a very straightforward case that needs to be admitted. Everything's done and back, or actually it doesn't even need to be admitted. It's just really straightforward what needs to happen. We're feeling like, sweet, nailed it. This is what's going to happen here. Okay, well, is everyone involved on the same page? Have we talked to the patient about admission versus discharge? If we are going to admit, have we anticipated that maybe the consultant isn't as excited about this straightforward disposition and might have another opinion about it? Another scenario might be that we feel like we have done everything for this patient that needs to be admitted, and all we need is a yes from the consultant. But the consultant might have had a different sort of day today. And if we're going to take that personally, that's going to cause problems for us. But just realizing we have no control of how the consultant on the other line will react, just like the consultant has no control over how me and the ED is acting, probably is very disappointed in my behavior sometimes. Like, no, probably is really disappointed that I think that the patient needs to be admitted. That's okay. And that's an honest conversation. You can just tell sometimes when you stop taking it personally, you can just start being aware that clearly the person on the other line is in the middle of something and it doesn't have anything to do with me. And by not taking it personally, sometimes I can offer support more than feeling attacked. This is all not a me problem, right? And realizing that, it lets me stay confident but firm no matter what happens on the other end of the line.
Yeah,
And
and
then
sometimes you can get a laugh out of it.
Yes. One time,
this is a good one. Yeah.
yeah, one of my favorite consults was one time was like, I consulted a surgical specialty and they were like, this is like freaking Desert Storm. And I was like, oh, not
What?
even close. Clearly, he is in the middle of what feels like a storm to him, right?
You might have
But
been
me not
having a
taking it personally,
PTSD flashback.
he was, I think there were like 3 cases back to back or something, and it just was overwhelming in that moment. But I did have to like cover up the phone because I did blurt laughing out loud. But hopefully he did not feel disrespected because I hope I covered up the phone in time. But like, people have their own lives going on. It's okay. And we can support each other, but it does require not just jumping to saying that, I did something wrong or something like that. Like, just keep your cool about it. People are having their own experience, and just be aware that patients and consultants are having a lot of stuff going on.
I'll find myself because I used to get really defensive. I took everything personally. And I find now, like, as I've done this work on myself and I've gotten to coaching, was that I find I have to buy myself some time. Like, you covered up the phone and like didn't laugh, but I have to use, like, I find myself going, that's interesting.
Mhm.
And I say some filler words, but basically I'm trying to get my brain to like jack back down to the level 2
Yeah.
that I started with. And so I'm finding myself go, wow, that's interesting. And I use a bunch of those words when in essence I'm saying a lot other expletives in my brain and say all the,
Yeah.
but
It's
it's true. You have to keep focus on like, oh yeah, you're having a bad day, but not to say that out.
it's better for me on the phone. Apparently, I do have a signature like stare where I'm running through the 60 things that I want to say in response to when the patient says something wild. I just kind of like go stone faced, and sometimes the nurses will be dying laughing because they're like, I know exactly what's happening.
And this is the why I still wear a mask at work. And I don't want to
I
offend
know,
anybody.
probably should mask
I'm just
up.
telling you, I mask up at
Exactly.
work
It's like
for this reason only. Don't call me
They
about
said
mask. I don't want
something.
to hear it. This is what
That really was. The mask was great for me because
the mask
apparently I
is
do have a
essential
signature, like,
now.
oh my God face that, like, what in the world? So, speaking of that, sometimes you're going to get patients that complain about everything. And that's okay. Guess what? They are allowed. They are stressed. They don't have their usual level of control. But don't take it personally because this is the first time for me in the ER. It's different for primary care, but they don't even know me. So, how can it be personal? I have literally just walked in the room. So, me even thinking it has something to do with me is a little bit egocentric, to be honest. It truly has nothing to do with us. I mean, unless you have done something, but usually is what I'm talking about. Brene does say that there are too many people in the world today who decide to live disappointed rather than risk feeling disappointed. And that is a sad place to be. These people are not having the best time of their lives. And listen, it's not going to change just because I and just my wonderful presence have walked into the room. They are allowed to stay in whatever rut that they're in, and that's okay. It really doesn't have a lot to do with me. And it's not worth inflicting more damage to point it out or trying to change them if I'm going to have a really limited interaction with them. So just things to think about. But step one is if you can, when it's appropriate, separate, is this a me thing or is this a them thing? And you'll find that almost always that is the power of emotional regulation, the way that we teach it, is that when you're settled and grounded, this stuff can go on in the periphery and it doesn't have the same effect that it used to. It doesn't derail you for days where my previous default would be to ruminate about it. Like, what did they think I was supposed to do? Or like, what was their deal? Like, why did they do that to me? It really isn't that complicated. They're having a bad day. Okay. Well, then let me reset and do the best I can.
Yeah, I'm with you on that. It would definitely go into the spiral of rumination. And it's so helpful too to consider that, like we talk about being a star thrower. You guys are star throwers. You are showing up to do the very best job that you can for the number of patients that were there to see you today. And so keep that in mind. And don't let, a crabby person on their worst day because of fear and insecurity derail you. You guys show up and you are giving your all to take care of those that are on their very worst day. So thank you for joining us today. And don't forget, go rate us, give us a review. Even if you just found it a little bit comforting today or one little nugget that you came away with, go leave us a review. It helps other doctors find us and it helps just increase our ripple in the universe. So we just launched a new version of our online course, Wellness 911. Go to our website, www.thewholephysician.com, to get more information. We take demoralized doctors from bride to fantastic with our easy and evidence-based Wellness 911 program. So until next time, you are whole, you are a gift to medicine, and the work you do matters.